Hello, friends. As you can see, I'm sitting in the project house. You can see the missing plaster. I just thought it was a nice, quiet place to come and collect my thoughts and record a little video. Kind of wanted to talk about why I'm feeling so burned out with my job. Partially, I mentioned I'm a nurse. I've been a registered nurse for 30 years. But I've been in a corporate setting for the last 10, and I've been working remotely, which is great, a great perk, and I earn a good salary. So many of my friends are wondering, like, how much, what more do you want? Like, you've got it all. You've got a great situation. And I just think the reason I got into healthcare to begin with, which, yeah, everybody says they got into nursing because it was a calling. It was not necessarily a calling for me, but it was something that I started taking care of my grandmother, who was lived with us when I was growing up, and I started taking care of her when I was about 8 years old. I started helping her with her insulin and helping her bathe, and I did her dressing changes on her diabetic foot sores, and it was I saw, and she was telling her friends that this is my little nurse. So from the time I was a little girl, I was being treated as a personal nurse, and I started learning that the best way for me to be valuable to people was to take care of somebody. So I've been taking care of people ever since. But it's been 30 years now that I've been a nurse, and I've worked in various settings. I did ER in the beginning. I did labor and delivery for a long time. I've done some home health and long-term care, and I've currently been in a Fortune 50 company for the last 10 years, and I'm in a leadership role now. I've watched the stock values continue to rise, and the culture continue to decline, and I've seen how the corporate healthcare is not about people. It's about making money. I've watched the health of the American people decline over the last 30 years, and I wanted to share my point of view with you. I did make a video a couple of years ago, kind of on the same lines, and I was in my car, and it was a horrible sound audio. So I finally I got a mic, so I'm hoping my sound will be a little better. But I did want to. I went back and looked at that video, and I wrote down some of my thoughts from the video. So I just wanted to kind of re-summarize what I had talked about then. I've watched the American healthcare system slowly decline over the past 30 years, thanks to factors like the move toward incorporation of hospital systems, big pharma, health insurance companies like the one I work for, and they're lining the pockets of the political decision makers. So policy is being written to just continue this trend towards privatization of healthcare. Medicare and Medicaid now is even being privatized, and the small community hospitals around the country are being closed because they're not making enough money to please the shareholders and the leaders. What I'm seeing now is, since COVID is unprecedented, COVID didn't cause the issues, but it has certainly accelerated them. And this is my perception from the inner corporate workings of the healthcare system. It's not just nursing burnout. While a lot of nurses are burned out, but there's a reason why. It's not just because we're overworked. This is more than what you heard about a couple of years ago, the Great Resignation. A lot of people wanting to quit their jobs. This is not that anymore. This is more than COVID. In my humble opinion, American healthcare is imploding. Your doctors and your nurses are doing the best that they can, and they aren't the problem. It's staffing, it's logistics, it's a corporate greed. It's the failure of our government to put the people first. This may seem dramatic, but I feel it's the truth, and that I feel it in my soul every day, more and more. Here's my message to you. The more complex and serious your health issues become, the higher the likelihood that the American healthcare system is going to fail you. My advice is to take responsibility for your health, for protecting your health, taking care of it. It doesn't have to be complicated. Stop drinking soft drinks. Stop eating fast food. Cook your own meals from real ingredients. Eat some vegetables. Take a walk. And stop smoking cigarettes if you do that. Stop putting poison in your body. I mean, even our food systems are in on this. Corporations own the majority of the same few corporations own the majority of the food that you see, the companies that you see in the grocery store. So shop around the edges, shop the fresh foods that don't have, if it was made in a factory, it's probably not good for you. Yes, I'm overweight. It's clear. I've struggled with this, but I really believe that American healthcare is not headed in a good direction. And the best that we can do as regular people is to take responsibility and take care of ourselves. There is a place for American healthcare when there's an emergency, when there's a trauma. It's great for, if you have a car accident, you break a leg, whatever. But for chronic illness, most of the chronic illness in this country is caused by a lifestyle of the American people and by the food that we're eating, the water we're drinking, just how everything is. You can get a pizza delivered to your door. Everything is just geared toward making our lives convenient, and it's not good for our health. And then the American healthcare system is just making a lot of people a lot of money. And I see it every day. People that really need the benefits when they have health insurance. The more complex your medical problem is, the harder it's going to get what you need, because they're going to deny your claims. They're going to make you appeal the denials. They're going to make you jump through a million hoops. And even people like me that work in the system have a hard time navigating it. So regular people that aren't healthcare professionals have no chance really to get what they need out of it. So that's what I think about healthcare, and that's why I need to get out of corporate healthcare. It is killing my soul. So yeah, I make good money and I'll get to work from home, and I've got a lot of flexibility and I don't have to work too hard, and I have nights and weekends and Christmases off. But and there's a lot to be said. That's what's held me. That's what I call the golden handcuffs. But it's healthcare, and American healthcare is not in a good place right now. So that's my point of view on that. Thanks for listening.